And so my role there at the OCD, I grew into the director of research and training, where really our mission was to do clinically relevant projects that would help our clients in the hope that maybe we could publish. So sort of like the first priority was, what are the questions we think we need to know for people who are not responding? And then if we can publish it, that's even better, that we can share that with people. And one of the things Adam and I collaborated on was this willingness study, and trying to understand. So in the sort of old models of exposure therapy, lots of focus on habituation. That feeling of my anxiety was really high, and over time it came down. And sort of intuitively, that would make sense as a marker of progress. You say, I used to be, this stressed out, and then in the same situation or similar situations, now I'm here. It's like, yeah, that must mean I'm getting better. But in studies on this treatment, that particular feature does not predict long-term outcome. So it's not actually something in a session that's going to tell you, how's this person doing?
It's too muddy. If you could perfectly control it, it has more value. But in session, there's so many factors going on, like a ritual, for example. We can do a mental ritual, feel reduction in anxiety, and say that's habituation.
Right.
So there is evidence that it, in theory, could be a helpful marker, but it's too hard in a naturalistic setting to be helpful as a clinician, really. Now, between trial, like over time, drops in anxiety tend to be a little bit more helpful.
Right. And like Adam said, it's muddy because you don't know what's happening when that habituation occurs. Like, suppose they did a very efficient ritual. You would get habituation. You wouldn't call it habituation, but you'd get somebody reporting less anxiety, but you don't know what that is. So in, this project really, like, there are probably hundreds of people that deserve credit for this, because where it started was anecdotal information from clinicians and from residents at the OCDI about what does your intuition tell you about. It's sort of like we all can sort of say, this is going well. This person is doing high quality exposures. And we're like, but what are the sort of non-specific things that we aren't tracking that we think are related to that? What is the thing that this person's practicing in a certain way that's different than maybe someone who's struggling? And so we started collecting data on a single item that we called willingness. And it was like a slider, like you could just slide it toward more willing or less willing. And easy way to describe willingness is watching two people do the same thing. Like we could use a fear of dogs. I use that one a lot. So two people could have this fear, and they both agree to sit in a room with a dog. Okay, like same situation. But one person, if the goal was to reach toward the dog, they're like, okay, like, this is amazing. I've never gotten, but I've never gotten that close to a dog before. Like, this is a huge deal for me. Like, I'm really doing it. But you can tell that's different.
Their body language.
Who's like this with the dog, still really scared, but they're showing I'm willing to be here. I'm doing this on purpose, right? And my anxiety symptoms, I'm not going to let them turn me into this.
So, Dr. Jason, I want to make sure that people, because most people listen. Okay, Jason. Well, I want people to know that y'all are doctors. You have done the work.
Believe it or not, somehow.
We'll talk about that next. Why it's not so important that we're doctors.
Okay, I love that, actually. That sounds very interesting to me. So that's Jason's voice that you are hearing, y'all. And what he just demonstrated, and I have actually seen this in videos. There's a person that I follow on Instagram, and I'm not going to say who, but I've seen videos of her doing exposures. And the first example where, yes, you are in the room with the dog and you are reaching towards the dog, but everything about your body language is indicating to that, I mean, at least I would think, to the fear center of the brain, this is dangerous. I should not be doing this at any given moment. This is going to be the end for me. And everything about that body language, because people are more than likely going to be listening to this, is demonstrating fear and a lack of willingness to just practicing fear.
practicing fear. It's not,
Yep.
it's not just showing the fear, because you can't see my fear when I have a relaxed face.
That's right.
And I'm sitting back, right? But I could still be practicing some other version of, I don't like this is bad for me. So what they're practicing with the physical, like relaxing physically and looking, willing to be there is one step, but internal willingness is probably the most important thing.
Yeah.
So if somebody's wincing and pushing themselves and they look very uncomfortable, but inside they have a story that says, I'm a freaking badass for doing this. Like, I never thought I would do this. And they're really have that kind of willingness inside, then maybe the outward expression of it is not so important. So this is the muddiness, right?
Yeah.
And so
the hard part.
we had coaches, the behavioral coaches helping the clients. We had the coaches rate willingness and we had the clients rate willingness. And that one item was a better predictor of their outcome over time than anything else.
So profound. Yeah. I mean, my favorite question is people like, well, I've flown on airplanes my whole life and I'm still scared. And this willingness always comes to mind. Like, well, what are you doing on that flight? What is your internal stance? What behaviors would I see? It goes back to willingness, right?
Yep.
If I can get on that flight with you and we start opening up and having fun and sort of treating turbulence like potholes, like woo, opening up to this experience, that's where new learning happens versus we call it white knuckling to help with the visual for those not watching the video. Like, your palms are turning white. You're just hoping that the flight's over soon and you somehow don't die. Of course, that fear is not going to change. Or I'm checking the flight attendants. Do they look scared? Yep. Or like, are the engines still there? Like, there's so many ways that we're doing an exposure, but we're not.
Right. And now we have this thing that we can point to and say, what was your willingness like? And we can give, students and trainees and staff the same information to say, like, pay attention to that willingness. If you can improve or open somebody's willingness up, then that's a more reliable indicator that they're going to do well in the treatment. And so that was one of the first things Adam and I collaborated on, having this sort of passion for understanding what's going on in these sessions, how can we do better at understanding it. And that it was a single item that wasn't validated and just based on clinical intuition and what we know about the science, but it was like never thought it would get published, but we knew it might be useful in-house at the OCDI. So including Adam was huge in bringing sort of a different perspective and ability to write things well for research papers that I feel like it was like perfect.
We got it published.
Perfect.
Yeah, but it was a shared passion for when, what gets in the way when exposure doesn't work. And that ties into ACT frameworks, my background in dialectical behavior therapy. We were talking about trauma. There's you got to know what to mix in there to really get someone to do the exposure, but also be open to it, right? Like we're talking about with the willingness.